So I will initially start up with how a gonad is being formed. Okay, so our understanding is that usually if there is an XS chromosome, it's a girl. An XY chromosome, definitely it would be a boy. So something which determines which gender you have to go about is called as chromosomal sex, right? So initially, you would have heard about the pronephros, mesonephros, and metanephros, etc. So the pronephros is the cervical most initial archinephro part. So it usually disappears after a certain period of time, probably between 3 to 4 weeks of gestation. This usually goes in for a disappearance. Then comes the mesonephros. So this mesonephros is usually seen exactly near your thoracolumbar region, and it is actually from this mesonephros. The draining ducts of the mesonephros is called as mesonephric duct, and you have a proper mesonephros part also. The mesonephros part is the one which is going to give you the proper renal calyx and the ureter. Okay, and next the final metanephros part. So this usually happens around somewhere between 4 to 5 weeks of gestation. The mesonephric duct appearance and the mesonephros further development will usually happen between 4 to 5 weeks of gestation. And next comes here metanephros. And metanephros is the part which is going to be your adult functioning kidney. And it starts around 6 weeks, and the formation happens until 9 to 10 weeks of gestation. So the appealing part that we will have to know about is actually the mesonephros. So in the mesonephros, you have a small thing that is called as urogenital ridge, which appears. Okay, so urogenital ridge is something which appears in your mesonephros, and this is going to be your primordial gonad. Okay, so all these things develop from the intermediate mesoderm. So they usually develop from the intermediate mesoderm and into the primordial gonad. Until the primordial gonad is usually formed until 6th week of gestation. By 6th week of that gestation, you will have something which is developing from this urogenital ridge, and that is called as primordial gonad. So until then, this particular gonad would be bipotential. It will not have any inclination either towards a male or a female gonad. So it will be bipotential. It can turn either way. But simultaneously, what happens is that you have some primitive germ cells, which usually appears in the epiblast, somewhere near the yolk sac. And from there, it slowly migrates towards the hindgut. And from the hindgut, it slowly enters into this genital ridge. By around 5 weeks, it will slowly enter into the genital ridge, and it starts inoculating this particular primordial gonad by 6th week. So by 6 to 7 weeks of gestational age, what happens is that this potential gonads gets infiltrated with the primitive germ cells. Okay, so this primitive germ cell along with the bipotential gonad is now going to determine whether this bipotential gonad is going to be ovary or is it going to be a testis. So how does it happen? Okay, so this is being affected by, so this is mainly affected by the chromosomal element. So if you're having double X chromosome, definitely the lineage will go more towards your ovaries. And if you have a single X and a single Y, it's going to be more of a male phenotype. But what you have to understand even more is that the mere presence of Y chromosome is not going to cause a lineage change. There is something in the Y chromosome which is going to actually determine that particular gonad's sex. And that region is called as testicular determining site, or it was earlier called as TDS, but now it is called as SRY region. Sex determining region in Y chromosome. So this is a genetic locus in the Y chromosome. If present in a single copy, is going to turn around the lineage of this bipotential gonad towards the testicular formation.